Welcome to SKK classes again. Today I'm going to discuss about the main treatment of the hyperkalemia. As in our previous videos we have already discussed about that what is hyperkalemia, what are the main signs symptoms of hyperkalemia, and what are the main causes of hyperkalemia, that why the potassium level that get increased in our body suddenly. So today we will focus on the main treatment regarding the hyperkalemia. Now see in this picture, the first line treatment is that we always give to the patient, that are known as membrane stabilization. That what we have to given first is the calcium gluconate, and its dose is 10 ml IV push, and its action is immediate, and its duration is 30 to 60 minutes. Means whenever any of the patient is having a hyperkalemia, then we have to or we have to do the action according to the doctor's prescription. Okay, so always if the patient, if any doctor have seen that patient is having a hyperkalemia, so he or she always gives you the order to give injection gluconate to the patient on the spot. Why? Because calcium gluconate always helps to relax the muscles of the heart. Okay, because as all of you know that in hyperkalemia what happen, the muscles excitability is there. Okay, if we will not give the injection gluconate to the patient, so lot of chances or 100% chances are there the patient can goes in cardiac arrest. So to prevent that, so that the patient will not goes in cardiac arrest, we will always give the injection gluconate to the patient. So what is the action of calcium gluconate? The action is that it will relax the cardiac muscles and prevent the patient from cardiac arrest. And one thing more here I would like to clear you, that whenever you are going to give injection calcium gluconate to the patient, so always kept in mind that you have to give it very slowly within 30 to 60 minutes, because this can direct, if you are giving the calcium gluconate very fast to the patient, it lot of chances are there that patient can goes suddenly in the cardiac arrest, or a patient can goes in bradycardia. So whenever you are giving calcium gluconate to the patient, so must be careful that you have to give it very slowly. Okay, if you will give the very slowly, then it will prevent the patient from cardiac arrest. But if you will give this injection very fast, it will lot of chances are that patient, it can put the patient into bradycardia or put the patient into cardiac arrest. So always kept in mind that whenever you are going to give injection calcium gluconate to the patient, so you have to give it very slowly. Okay, and next second line, that is membrane stabilizer, is your normal saline hypertonic 3%. Okay, and it should be given in the dose of 50 ml IV push, and it can be within 1 hour you can give this one, and its action is also same. Then comes your shifters, that is here it will come then insulin with 25% dextrose. So whenever you are giving 10, means you have to dissolve the 10 units of insulin within 25% dextrose. So why it's given, and it should be its action is within 20 minutes, and it should be given within 4 to 6 hours. So what is the action of this? Suppose sometimes what happen, patient will goes in like in hypoglycemia. So to prevent that, insulin plus dextrose, they both are the shifters. Okay, so they will bind, and they will bind with the extra potassium in the body and helps the body to excrete it outside. Okay, next is your albuterol, that can also be given 10 to 20 milligram in 4 ml of normal saline, uh, nebulized over 10 minutes, and its onset is 30 minutes and duration is 2 hours. But if you are giving like insulin, then after that you have to follow this one. Then if you albuterol is not able, so you have to start the furosemide or diuretics. These are also known as loop diuretics. 40 to 80 milligram IV within 15 minutes, and its duration is 2 to 3 hours. Or sometimes doctors will ask you, or give you the order to start the infusion of furosemide or injection diet, or you can say. Okay. So what, or lasix. So what is the main reason behind that? All of you that I already cleared that what happened, the reabsorption of potassium in the body, that will takes place in the DCT, or in the distal convoluted tubule of the nephron, which is the basic unit of the kidney. So furosemide, they will help to increase the urine production. Okay. And if the urine production will be more, then what will happen, the reabsorption of potassium, that will be more. So more potassium that will get excreted from the body. Apart from this, sodium bicarbonate, that can also be given if sometime if doctors, but the sodium bicarbonate is also having the same action. Then comes your excretors like a sodium polystyrene sulfonate. These are this is also known in the brand name of K-bind sachet. So K-bind sachets means they are K-bind sachet means K refers to potassium. So these are the potassium binders, means the extra potassium that will bind with this K-bind sachet and helps to excrete outside the body. So these are you can say act as the excretor. And last option is always, that is hemodialysis. Okay, means hemodialysis means doctors can advise the patient or no, that we can start the dialysis of the patient, especially if the kidney failure is there, or any disease which is related to kidneys is there. So, and the duration of that dialysis will be 3 hours, and the main motive of that dialysis is just only to remove the extra potassium from the body. So this is the main treatment that is always given to the patient who is having a hyperkalemia. So I think now it should be very much clear to all of you that what is hyperkalemia, okay, and what are the main signs symptoms of hyperkalemia. Means if the patient potassium level will increased up to more than 5.2, then the patient will goes in hyperkalemia. Okay, and what are the main causes that we have already discussed in the name word of frames. Okay. Okay, frames refers to, F refers to failure of kidney, R refers to rhabdomyolysis, A refers to Addison disease, then your M refers to metabolic acidosis, then E refers to excess administration of potassium, then S refers to spironolactone. So these are the main causes which cause hyperkalemia. Then we discuss the sign symptoms under the name of murder. Okay, so, and now we have discussed the hyperkalemia treatment. So this is all about the hyperkalemia. So if you have any query regarding any of the point, you can contact me on my WhatsApp number, that is from New Zealand. So thank you for watching SKK Classes NZ.